Antibiotics for the UTI, you might want to think twice before you take them. If you or someone you know deals with urinary tract symptoms, you know very well that typically after you take a round of antibiotics, you might feel better for a little while, but soon enough, you're back in the doctor's office getting prescribed more and more antibiotics, and this cycle can continue on for months, if not years for many people. For those that need evidence for why they should not rely on these drugs, here it is. There have been about 10 placebo-controlled trials done on this. Here is a 2020 review of these randomized trials. It concluded that although taking antibiotics prophylactically reduced the risk of developing another UTI or the symptoms of UTI, this was only the case during actively taking the antibiotics, and it did not last after you stop them. Quote, the effect seems to be limited to the period of antibiotic intake. Durations of taking antibiotics greater than 12 months have not been studied in a controlled setting. Another review, a Cochrane review of the same randomized trials, showed the exact same thing. Quote, once the antibiotics were stopped, UTIs recurred and equaled those of the placebo arm. This data confirms our clinical suspicions that the effect of taking antibiotics on UTI is only short-acting.